Good morning, Dr. Ferguson coming to you from the Passioncam again, and we're going to talk a little bit more about exercise today. Exercise is a critical part of life, and regardless of how hard you think you work or don't work, you still need a regular exercise regimen. You need something that you do on hopefully a daily basis, but at least 3 to 5 times a week, something that you find important. If I ask you when's your birthday, you know when your birthday is. If I ask you when is other important dates in your life, you'll know that. Well, exercising has to be important too. It has to be on the calendar every day at 3 o'clock. I'm going to do my exercise. Nope, can't go to town. Nope, can't go out there. Nope, can't take you over to Brother Joe's house. I got to do my exercise. It has to be important. It's not something that you just do haphazardly when you get time, if you get time. That doesn't work. It's got to be on the calendar. It's got to be important. Start where you are. Start simple and move your way up from there. But one of the important factors when you start your exercise regimen, if you do it consistently enough, and again, there are the numbers that are thrown around, it takes 21 to 28 days for something to become a habit. And once it becomes a habit, then you're much more likely to do it when you don't feel like doing it. And that's what you want. You want a habit of an exercise regimen. So whatever that regimen you might choose to do, you have to do it consistently enough that it becomes a habit. See, the problem is, before it becomes a habit, then if you wake up and you don't feel like doing it that day, then maybe you don't do it. Once it's a habit, you'll push yourself to go on and do it, even though you don't feel like doing it. Because one of the things that you'll find when you develop a regular exercise regimen, that you feel better. Regardless of how you felt before you started, you almost always will feel better when you do your exercise. Now, for those of you who might have severe arthritis or some other medical issues, you might need to check with your healthcare provider. But for most of your arthritis, exercise is going to make that feel better too. Even though you say, oh, it hurts too much to exercise. Oh, my joints can't do it. But if you do it, you'll find that your joints are less. They hurt you less. Now, when you talk about different disease processes in exercise, well, things like arthritis, well, exercising to a point is going to make you feel better, and if you do too much, it makes it feel worse. And your body will tell you what that point is. The key is to have an exercise regimen that you do on a regular basis. Let it become a habit, let it become a way of life, and studies have shown that if you do that, you'll live longer, live healthier, feel better, have less chronic disease, maintain your weight better, etc., etc. When you decide to do what you're going to do on your exercise regimen and you begin doing that, you'll know what muscle groups it's affecting by what gets a little sore when you do that particular exercise. Now, you don't want to overdo it. You want to work up to that, to your right amount. Now, many people talk about different amounts and what's good and what's bad. But what I can tell you is that you got to start somewhere. Now, is 20 minutes a day the magic number, half an hour, an hour? I don't really know the magic number, and I don't think there's a consensus amongst exercise gurus. But what is important is that you do something, that you're consistent with it, that you're regular with it. And if you can even do something for 10 minutes a day and you're consistent with it, that's going to bring some benefit. 20 minutes will probably bring more benefit, 30 minutes will probably bring more benefit. But even 10 minutes a day will bring benefit to your life, to your health, to a way of doing things. It gives you more structure, it helps you be more organized, it helps start your day off better. Me personally, I like to roll out of bed and do my exercise because my day gets so busy, and if I don't do it just first in the morning, I may never get to it. So I try to roll out of bed, do my exercise, and kind of go from there and start the day feeling good. Now, along with your exercise, we can talk about nutrition and all those other types of things. So maybe we'll talk about that a little bit some on our next one. All right, on that note, be blessed. Dr. Ferguson coming to you from the Passioncam. Bye-bye.